Greetings, everyone. My name is DJ Wells, and you've tuned into our weekly podcast or weekly webinar, Coping with COVID, where each week we come to you and talk about some of the things that might be on our minds, some things that we might be wrestling with as we all struggle through this COVID-19 pandemic. We appreciate you joining us today, and we're very blessed today to have a special guest, Dr. Michael Stevens. Dr. Stevens, well, I could probably do an introduction that would take up the bulk of our time that we've got allotted here, and so I'll just say that Dr. Stevens is a highly regarded expert in the field of international psychology, and Dr. Stevens and Dr. Mensah will today be talking with us about culture and context and how those things kind of relate to what we're struggling with as it relates to the pandemic. This is an interactive activity. This is a webinar for you, and so we encourage you, as you have questions, please do send them to us. We'll allow Dr. Mensah and Dr. Stevens to have a conversation for the first 45 minutes or so of the time that we've got allotted here. But then if at the bottom of your screen, you'll click on the button that says Q&A, you'll be able to type in questions, and towards the end of our broadcast, I will read those questions to Dr. Stevens and to Dr. Mensah. So please do send us questions. We're excited to take your questions and to make this an interactive conversation as much as we can. And so without any further ado, I'm going to turn things over to Dr. Mensah to begin our conversation. Again, send us those questions in and we'll answer them as we get towards the end of our broadcast. Dr. Mensah, thank you for joining us. Dr. Stevens, thank you as well. Dr. Mensah, take it away.
Thank you, Mr. Wells. I just want to sort of caution everyone. We're doing a lot of discussions during this time period about a lot of various topics. And one thing I want to remind everyone is that we're not here to be fear mongers in any way, shape, or form. But as physicians, we do have to remind people that COVID is not under control in the United States of America. Please do not be deceived. Don't let the opening up of stores and everything fool you. The key here is to protect yourself amidst all of these openings. Okay, we actually see a spike and increase in many areas in many cities that have opened up their services. So please be cautious, still be protective. Okay. Now, I don't want to be a Debbie Downer, as they say, and if anyone out there is named Debbie, I don't want any emails about using your name. It's just a little analogy here. Dr. Stevens, folks, we've got a real opportunity and a real blessing here, as Mr. Wells stated earlier. We have the man who is known as the father of the whole arena of international psychology present. Dr. Stevens, before you begin, would you please share with everyone how you moved in this direction, how you got to this field, this arena that is now known as international psychology?
Happy to do that, Dr. Mensah. And first, let me thank you for your generosity in inviting me to participate in the webinar this afternoon, and to Dr. Wells, Mr. Wells, for all of his help and kindnesses, and also a quick shout out to Mariam Tafreshi, who made us, who helped connect us in this. So, with regard to my personal journey. Sorry about that.
Well, I'm not the only one.
No, you're not the only one. You can feel better about that. Real quickly about my own personal journey. I grew up in a very diverse community in Manhattan, in New York City. And in fact, German was probably the most common language used. And there were very, very many different national, ethnic, racial groups in our community, Washington Heights. And my first experience, in fact, of feeling different was when I left that community to go to a private school and to a college, which was basically composed of folks who were not particularly ethnic. They were basically white Anglo-Saxon Protestants, and I really felt kind of out of place, to be honest with you. And I was too young to really understand what that was all about, but I felt different. I also felt when I pursued my doctoral studies and early in my career as a professor that the kind of research that I was doing was, in essence, isolating the individual from the context of who they were. We typically collect demographic data on participants in research projects, but that was basically as far as it went. We really didn't look at those kinds of variables to understand how our participants were understanding the research protocol and how they were responding to it. So I felt for a long time that kind of reducing the individual to a subject in the absence of the context in which this human being was responding was missing something. And as a result, I really felt that my career was going somewhat stale. I happened by accident to encounter during a convention of the American Psychological Association an open door where there was a kiosk announcing the formation of a new division, the Division of International Psychology. And wandering around like a lost soul, sort of in a mid-career crisis, if you will, I walked in and I just discovered that they were talking about many of the dimensions of lived experience that had been so long neglected in the research that I was doing and reading. They were talking about a culture, socioeconomic status, gender, race, religion, national narrative, and so forth, and all very much a part of the variables that were being examined, not just descriptive information. And so I was enthralled by this and decided to join and pursued various appointed and elective offices and did some traveling as well through a Fulbright grant to Romania, which had always interested me because my father's family hails from there. And one thing really led to another, and my career took a dramatic turn from being a clinical psychologist to an international psychologist. And much of the work that I've done since then, while it has examined health issues, has done so, again, from a contextually informed framework.
I love that. What I so enjoy is that, while we've never used these terms before, I guess psycho-individuality, as opposed to what we do in terms of bio-individuality,
Right.
But the overlapping space is looking at the context of this unique individual with all the variables that have come to form or shape that person. And that's what is so wonderful about the field that you're in. What's happened a lot in psychiatry these days is trying to lump people into categories now. That's what the DSM-5 does. It basically lumps people. And there was a big challenge in determining how that manual of psychiatry is really going to go. The individual folks versus the lumpers, and of course the lumpers won. But what was so intriguing is that your journey brought you to the point of saying, hey, wait a minute, we're missing something. We're missing context.
Correct.
How this person is uniquely being challenged by their environment, by their family, by their friends, by all sorts of factors, if I'm correct. And that's just amazing. And that's what's been missing. That's what we have to get back to, no matter what arena we're in, whether it's the biomedical or the psychiatric. And so we're greatly honored that you're here and able to sort of talk to us and share this with us.
Let me
Dr.
add,
Stevens.
thank you so much, Dr. Mensah. Just a quick addition, piggybacking on what you had already said about the DSM. As you well know, in psychotherapy, there is a push towards manualized therapeutic interventions that are empirically supported in some way, shape, or form. And so there are some who have even argued that no therapies should be taught to aspiring psychologists in their graduate studies other than those that have been empirically supported. Well, the question really is, can we generalize some of those studies to everyone everywhere? And the answer, of
Mhm.
course, is no.
Yes.
We can't. And I'm certainly not advocating operating by the seat of one's pants when it comes to intervening in someone's life. But at the same time, there really needs to be a flexibility in how we approach the people that we aim to serve, which allows us to incorporate, as you pointed out, that wealth of contextual variables to
Well,
tailor interventions to meet them in a way that they feel is legitimate given their context and will actually prove to be even more effective.
well, if our objective algorithms were so accurate, why is it that all people aren't better? Okay,
Yes, that's the fundamental question.
I think it's rather, forgive me, it's rather arrogant of us
Mhm.
as institutional providers to suggest that we're going to take care of the mass group of individuals with a singular protocol, a singular algorithm, a singular methodology. And none of us really believe that or say that, but what we're being told is basically do that.
Right.
If you use the same empirically provided pieces of information or process and procedure rather to take care of all of these cases, when of course they're unique and they're individual and they're distinct and they're circumstantial, okay, and there are no paradigms that come up with or that encompass all of these potential variables. That's why we have conversations. That's why there is subjectivity. How this person relates to you creates a sense in you about what direction you need to go.
Correct.
And
Absolutely.
you can do that without learning who this person is.
Mhm.
That's why we talk about it. We used to joke back in the old days, and we take out our glasses when pretending to be psychiatrists and say, tell me about your childhood. You know, that old phrase.
Yes.
Well, why do we even joke like that? Why do we even ask the question? Because the childhood was key in the formative years. Now, if your childhood was in Bulgaria, if it was in Romania, if it was in Germany, that's going to change your future outcome,
Absolutely.
especially depending on where you trip. So it's key to look at the subjective aspects as well as the objective. Now, of course, I brought up Germany for a reason,
Mhm.
as you and I had quite a bit of a conversation previously about how you go back, how you're very well tied to those roots of yours
Yes.
in a different country. Would you mind sharing a little bit of that as well, Doctor?
Yes. In particular, the my interest in Romania was basically because I didn't know very much about my father's family history. And so that was the country that I was most interested in becoming more familiar with, just discovering something more about that part of who I am. And it was very difficult, obviously, to gain access prior to the fall of communism. But I had a very serendipitous encounter with an assistant dean at Illinois State University over dinner, and he was visiting a number of universities in East Europe that were opening up after the fall of communism. He knew my interest in Romania, and he said, "There's a rector at University of Sibiu in Transylvania, a very dynamic individual, speaks fluent English, and you might be interested in touching base." So I did. Those were the days when you had to fax and get up very early in the morning to fax something over there. I sent a crate of books because books on psychology had not been available in the country for many years due to the regime's outlawing, essentially. of the discipline and profession. And again, I visited there, and I attempted to learn some of the language before I did my Fulbright, which was the year after my initial visit. I had the wonderful experience of teaching the first class of graduating psychologists since the discipline was outlawed, since psychology was basically removed from the universities. And these young men and women were absolutely thirsty and hungry for everything and anything. And they kind of swallowed whole what I was able to provide because it was so new and different, particularly the humanistic, the existential perspectives in psychology and psychotherapy. But more important than that, in terms of my own professional journey and my own process of becoming more culturally competent, were so many of the things that I learned the hard way. I made a number of, I try to be sensitive, respectful, humble, but inevitably, because I don't know that much about the culture, and the only way you can really learn about a culture is to immerse yourself. I made some faux pas, to say the least. Some are funny, some in retrospect, they all are funny, I suppose. But, I remember one time, everyone was so interested in meeting an American. And so I'm somewhat introverted by nature, but I was getting all of these invitations to join families and have dinner and so forth. So I had one dinner, feast, and then I had to go somewhere else for a second dinner a few hours later, and I didn't think I could do it. And so I went to someone's home. Those were the days when people were spending, about 75% of their, well, maybe that's an exaggeration, maybe 50% of their income on food. And so I go to someone's home, and they prepared just a wonderful meal, gone to great effort and expense, and I was kind of playing with my food. And the head of the household got up dramatically and slammed his hands down on the table and basically accused me of disrespecting him and his family because I wasn't eating. And so I dug deep and started eating, apologizing profusely, for, and I made up a white lie that, I wasn't feeling quite myself. But it's those kinds of things that you really learn when you immerse yourself. And there's a quote that I really like from Mark Twain, in which he's alleged to have said, "I never let my schooling interfere. I never let my schooling interfere with my education." And we can read about culture, which is valuable. Don't mistake me on this. But to actually accumulate experience, to discover, to make errors, to critically examine what you have done, to have a cultural guide to assist you in this trial and error process is invaluable. These life's lessons, Dr. Mensah, I've never forgotten those stories because they remind me of how much there yet is to know. It's a lifelong process of becoming culturally competent. I'm on my journey, and it's never going to end.
That's wonderful, as we all are in one way or another on that journey. Something really intrigued me, and we haven't really talked about this before, but cultural competency. Wonderful term, but it certainly predisposes the idea that there's cultural ignorance.
Sure.
And right now we see this vast wave of trying to set aside some levels of cultural ignorance by way of just beginning the conversation around how do we obtain some level of cultural competency in a multicultural society. It's very easy to go to China. It's very easy to go to Russia and have the entire cultural experience at least available to you. It will take a lifetime to become competent, and maybe you never even get there. But here in the US, we have hundreds of cultures and subcultures sometimes.
Absolutely.
Even when we have separate cultures coming together in marriage and to have children, there's a new culture developed within that cultural context because there are two cultures of origin, and now they create a third culture of creation within the context of the larger global culture of what is supposed to be America.
Right.
And that gets to be very confusing.
It does.
Especially for the kids.
It does.
So as we seek to better understand, I think the idea of international psychology is so important because we here are an interesting, really, test tube of didactic dynamics. And yet what we really are looking at is the in vivo experience, okay? Not the in vitro experience. A test tube is one thing, life is another.
Indeed.
And if we're not putting things within that context, it's a whole different story.
Mm-hmm.
So I promised I wasn't going to talk a whole lot, but you said some interesting things that took me to some very different places. And you still go back and teach very frequently. You're very rooted in that. And that's something I'm not sure a lot of people know or recognize. But let's move from that and share with us what we're going to talk about today.
Okay, let's do that. Did we want to focus a little bit on culture and COVID-19, perhaps, or?
Absolutely.
Okay.
Absolutely. Whatever you feel appropriate, that's what we wanted.
Sure. Well, I think
a lot of it this time.
No, I'm sorry. I was interrupting you. What were you saying at the end?
I said we've given you a tremendous amount of latitude in conversation.
Oh, okay.
We want to hear from you in this.
Of course. Well, one of the things I think that's very interesting is some of the differences in terms of how different cultures, different nations are managing the pandemic. And we can take a look, for example, of some of the successes that we've read about or maybe know about, some of us who are listening in personally. How China, for example, has handled the pandemic within its own borders, the success of South Korea as another example, the success of Singapore. And we begin to get the feeling that some of the East Asian countries have been remarkably successful and effective in mitigation. And then we look at Italy. We look at Britain, United Kingdom. We look at our own country. And there seems to be not only far more cases, higher mortality rates, what may be perceived by some as a chaotic response, given the different levels of government that are often passing the buck, if you will, which is sort of my own personal perception, but certainly a less than ideally coordinated response. And one of the questions certainly might be why does it seem to work in certain cultural contexts? That is, efforts to mitigate and gain ground on the disease, and why has it been so difficult in the United States? And I think one of the things that we can look at are, without stereotyping now, but just speaking in very broad terms, certain dimensions of culture that differentiate, let's say, China, South Korea, Singapore, from the United Kingdom and the United States. And when we look at dimensions of culture, we typically think of them as kind of bipolar, continuous dimensions, and some of them we're familiar with, individualistic versus collectivistic cultures, where on average, incumbents or members of a particular culture might view themselves as autonomous, independently functioning individuals within the larger community, whereas in a collectivistic culture, individuals are intricately interconnected or interrelated to one another And
Mhm.
the emphasis is placed much more on social harmony, collaboration, cooperation, rather than sort of the lone wolf in the individualistic type community. We can also look at a dimension called tight and loose cultures. In tight cultures, we have a situation in which authority is more centralized, in which members of that culture or country are much more likely to rely on central authority in guiding them through crises. Whereas in loose cultures, rules have a different meaning. Rules are not necessarily going to be followed as exactly and thoroughly as they are in tight cultures. People are socialized within those kinds of cultures to take matters into their own hands. And these guidelines for mitigation, for example, wearing masks, social distancing, hand washing, and some of those basic kinds of things that have been recommended. Well, we see them all the time in stores. You mentioned something very early on before we got underway, and that we are still under a pandemic. There are states in which have opened up, and the incidence of positive COVID-19 tests have increased rather markedly. The stock market today went down about 1,700 points because people are panicking that there's going to be a second outbreak. Governors of those very states have said that they're not going to reinstitute some of the lockdown measures, that we need to open up the economy. So we have a situation really in which we really could look at the different successes of different kinds of cultures in view of the dimensions that tend to characterize those cultures. There are others as well. For example, cultures can be classified as indulgent or restraint. Indulgence versus restraint. We live in an indulgent culture. We want to go out and party with our friends. We want to go to the bar and dance, go to a restaurant, go to the beach. And we've seen pictures of people who have gone to the beach, and they're certainly not observing, in many of the photos that I've seen, some of the basic mitigation strategies that have been recommended so highly. Whereas more of the East Asian, particularly the traditional East Asian cultures, tend to emphasize restraint. And why is restraint emphasized? In part because of this notion that social harmony and cooperation is critically important. And so we restrain our individual desires and needs for the benefit of the greater good. All of this can translate, and there are more if we want to talk about them, all of this can translate into our better understanding of what's going on that seems so different when we compare countries and how they are either succeeding or succeeding more rapidly than our own country, the United States. I'm not saying good or bad. I'm saying different. And in certain circumstances, centralized authority, a monolithic government, in times of a crisis, obviously they have an advantage. In times when there isn't a crisis, certain freedoms are going to be curtailed, which we're able to enjoy in our country. So nothing is good or bad, but with regard to responses to COVID, I think we can look at that in terms of some of these dimensions of culture. And we can even look at that within our own country, Dr. Mensah, if we look at how different cultural groups within our country are reporting higher incidence of COVID-19 than the the surrounding community in which they're embedded. And one example of that would be the Somali community in Minneapolis,
Mm-hmm.
which has a very high rate of COVID positives relative to the white majority community. And there are lots of cultural reasons for that, one of which that I was reading about, and I'm certainly not that familiar with it, but from what I gathered, there's a long history of distrust of authority in the immigrants that have come and settled in the United States. And so, and this may very well be true of a number of other immigrant groups, as well as minority groups within our own country, distrustful of authority. And so, in part because of that national narrative, that narrative that's passed on from generation to generation, you'll see cultural communities sort of not following through on some of the basic mitigation strategies. So, I'm not quite sure what exactly to do with that in terms of a public health issue. But there's a way of understanding it, and a way of understanding it that allows us to take a step back, and instead of judging or blaming or in some way demeaning a particular cultural group because they are not responding as we are responding, we're doing it the right way. I think if we take a more open approach to discovering the whys and wherefores, we're in a much better position to perhaps even at a public health level intervene to try to position these mitigation strategies in a way that's more compatible with the cultural traditions that hold in these other communities.
I think that's a very interesting point. So we might say that we're dealing with two major pieces here to this puzzle. One being perhaps microcosm, the regional attitude, whether it is city, state, or otherwise, versus the macrocosm, which might be more the governmental situation, the federal situation, the entire country. And that's where we have already comments from governors, and let's just call them the micro leaders, if you will, not diminishing power or context, but just looking at their sphere of influence. These are their people. They know them well. That's right. The idea. But I think if we brought more of an international psychological approach to the demographics and started to target those areas based upon perceptions, such as what you're referring to. Listen, when we go to this community, the Somalis are there. We have to help them, help breed trust so that they may follow.
Right.
We've got the workers, the people who are going to be out of work here, and that's why they want to go back to work in this town, and let's just say Detroit or in Chicago or wherever it may be. And we've got to help sell them on the idea that, if they can hang in there and we can do this and shift some things around, they can live through this much more comfortably. Mm-hmm. We're in a much better place than trying to just provide sort of blanket rules and blanket commentaries without really addressing the needs of the individuals within that microcosm.
Right.
I want to throw something out there that's a little bit different, and it might get some of us in trouble, but it really shouldn't. Let's talk about sex.
Okay, let's do that.
Now, everyone just perked up their ears, but it's not what you think. Leadership. When we talk about, there's been some interesting discussions about the sex of the leader involved in any given country and the success of stopping this creature. And it's been noted that many of the countries that have had successful approaches to treating and stopping COVID are female leaders. Mm-hmm. And New Zealand, for example, yes. Powerful discussions around the approach taken, the perspective taken, the implementation taken, and you've got a 0% rate of COVID present. Mm-hmm. And not just in New Zealand, but other countries as well. Doctor, how do you throw this into the mix?
I'm definitely going to get into some trouble now, Dr. Mensah.
I know. Had to do that to you.
Thank you for that. Um, well, there are several reasons why I think New Zealand has done so well. Part of which is its isolation, geographic isolation. But let's take a look at that larger question of the sex of leaders. I don't want to stereotype, so I'm not going to do that. But I think one of the things that, in general now, men and women are socialized to approach crises and tasks in a different way. Now, again, I please no one in the audience take what I'm saying as to be true for all women and all men, but I'm speaking sort of in general terms. One of the criticisms, for example, of some of the male leaders is that they lack compassion. Mm-hmm. They're analytical. Mm-hmm. They're instrumental. Here's the problem. Here's what we need to do. It's black and white. We either shut down, we open up, either or, yes, no, right, wrong. Let's just do it. And relatively little consideration, I think, for the other side of the issue, the lockdown versus the opening up. Relatively little consideration for what people are actually experiencing in their lives, whether they're auto workers or people living on the edge who now have no income, or they're about to lose their business. So there's a sort of compassion gap. There's a compassion gap. There's a listening gap. As a psychotherapist, as a clinician, I can tell you that so many clients tend to prefer female therapists than males. Mm-hmm. Part of that is that women are perceived, maybe it's just a perception, but maybe it's also factual in part, that women are perceived as listening with intent. They really want to get to know. And when I listen to the Prime Minister of New Zealand, she's pretty tough. You don't get to be a prime minister of a country without that. But at the same time, I think she is a great example of someone who combines leadership, authority, problem solving with compassion, understanding, a willingness to listen. Again, to understand the lived experience of the people who are actually threatened with COVID or have actually lost ground in their lives, either a loved one who's passed away or an elderly person that can't be visited or their business and so forth. So I think there are some ways in which men and women, again, in general, are socialized to approach crises differently. When we listen, and this is true of physicians as well as psychologists, when we listen, when we get to know our patients as human beings in context, we establish that relational bond. And that relational bond can be established with an entire people by their leaders. I get that sense that this is true in New Zealand and not so much in other countries where there are male leaders, maybe even female leaders, who are not listening with intent, who are not approaching the problem with this sense of, I don't really have all the answers. I need to hear from you. What works best for you? That conversation between a leader and his or her elected, the population is so important in bringing people together in a collective sense to work towards mitigating the crisis. So that's just sort of a top of my head thought about maybe some of the reasons why we see such differences. If people are really feeling understood, cared for, listened to. And there isn't sort of this like, purely top-down approach that leaves the stakeholders that are most at risk out of the equation. If that's happening, you're not going to get the kind of response that you see in New Zealand, I think.
Absolutely, absolutely. What was interesting about the Prime Minister of New Zealand, someone sent me something very interesting, which was a poem that was written by the minister and shared by the Prime Minister. And I was blown away. I read this piece of poetry and a tad bit of prose thrown into the mix. And what it did was reveal her humanity.
Mm-hmm.
When I read this, I saw a human being.
Mm-hmm.
I felt the person and the person's relationship to strife, to context, to difficulties, to joy, and to sadness, all revealed.
Mm-hmm.
And my first thought was, this kind of exposure is very endearing to the understanding that there is a person who is there spearheading and trying to guide and shape and protect your life, as well as those of your countrymen. I had never seen that before. And even as I think about it, I'm impressed still over and over and over again. Once again, certainly not trying to be sexist in any way, shape, or form, but from my experiences back in med school, most of my friends in the closer circle were female. It didn't always work to my favor because I got teased a lot back then by 4 females constantly around me. My partner is one of those people. Now we're 50-50 one-on-one, and I get even. But back in those days, there's a lot of teasing and a lot of fun. But what I saw was interesting as I looked upon how my colleagues approached study, for example, or problem solving.
Mm-hmm.
And they approach it from a very different angle. It's multifaceted. It's not quite so much unidirectional. This is not true for everyone, and I'm not trying to grossly generalize.
Mm-hmm.
But what I think is missing quite often is the idea, the concept of taking a look at whatever the issue is and turning it on its side, of approaching it from multiple angles and different directions. Mm-hmm. Many business owners are very clear that when they're looking for a certain competency in certain executives, they're looking for a female mother. They want somebody who's been basically multitasking schedules, putting together plans, actualizing the directions, and taking care of their families, because they're great multitaskers and problem solvers. Mm-hmm. And I think that's a very powerful, powerful tool in times of crisis. Yes. But unfortunately, probably not the most well-utilized tool. As even one of my colleagues would share with me, sometimes I can be very directed and focused. I said, yes, but the other side is that we take a look at the opinions of those around us, mm-hmm. and those around us are female. Mm-hmm. So there can be distinct advantages, and I'm not trying to be grossly sort of generalizing in the situation, because quite a few of the successes in leadership are also male. That was one of the difficulties I had with the study that came out. Asking the question, male versus female, is this a real variable? Is this a real factor? I think it is, but at the same time, as you pointed out, what kind of culture, what kind of society are we talking about within that context? Is it a collectivistic, an individualistic? Is it a delayed gratification phenomenon? What is it that allows that kind of success? And it is so very multifaceted. But I simply had to go there with that question, Doctor.
No, I think it's a wonderful question, and I think kind of bridging that connection between male and female leaders, we can look at this really because one of the things that I had mentioned is that we are socialized as men and women into our community, and if we, I mean, you could socialize a female to be like a male, stereotypic male, and vice versa. So this is learned. Mm-hmm. I believe it is. Certainly there are some evolutionary and biological differences that are at play, but I think most of it is learned. And I think when we look at competencies, cultural competencies, we can sort of imagine now that there are potential leaders out there who could acquire the same competencies that you described of the Prime Minister, a strong leader, a decisive leader, but one who is empathic, who is human, who is open, who is humble. It doesn't have to be either or. And so, you know, when I look at cultural competency, which is something that you had brought up earlier, and how we get there, I think there are two qualities, if you will, that I think are incredibly important in that, and it's also relevant for leaders at local, state, national levels, and that is respect and humility. To be able to appreciate genuinely the perspective of others, and to be excited about discovering the perspective of others. In this case, when we talk about leaders, the people that they serve. And humility, which is not knowing all the answers, not having all the expertise, but being willing to engage relevant stakeholders from the bottom up, community leaders, grassroots folks, and experts, to collectively try to fashion a multifaceted, holistic approach to a very, very complex local, state, regional, national crisis, such as COVID-19. So there are certain personal qualities, and the question is, can you actually cultivate these? And you know, as you and I in the health professions know, there's some limitations on what people are capable of. But in general, I would argue that a whole process of becoming culturally competent, culturally intelligent, is one that I think you can develop certain protocols, courses, trainings that get someone farther along the pathway to being this leader that combines the best of both. The best of both. So, you know, it's not just a stereotypical female or stereotypical male leader that I think would work best, but one who has sort of acquired and can demonstrate the best qualities of both gender roles, if you will, depending on the circumstances. There are times when I'm sure the Prime Minister of New Zealand has to be pretty hard-nosed about things. But in a national crisis that's affecting her people, we see the benefits of that softer side, that more compassionate and empathic side. But I believe it can be trained. I believe people can be trained and acquire those skills.
Well, certainly in the non-pandemic days, going back to the UK, with former Prime Minister Margaret Thatcher, for example.
Right.
You know, here was a very solidly, in fact, oftentimes criticized because of her very direct and non-soft, shall we say, approach to governing. She was hardcore and criticized for that.
Yes.
And many females talk about the idea that if you present that way, even within the business structure, business organization, you're looked upon negatively. And yet if you present too soft, you're looked upon stereotypically, and therefore not worthy of advancement. And we come across all of these sort of double-edged swords and non-appropriate stereotyping going on here in areas of leadership.
I was just going to echo what you said, Dr. Mensah. It's a real bind. It's a double bind for women, clearly. I mean, it's almost a no-win situation. And the pressures and burdens of trying to strike that very fine balance, I think, are pressures that a typical male leader doesn't need to be as concerned about.
Mm-hmm.
If I can I'm sorry, Dr. Mensah, go ahead.
No, I was going to say, so maybe one of the things we need to do is for our leadership, to go through perhaps a miniature crash course in international psychology before they actually take the reins of office, whether it is regionally or otherwise, to start kind of take a look at some of the things we have to consider when we're in process. That's why we're supposed to have advisors who are helping our leadership, but they've got to be sort of plugged to be more in tune, especially in different regions of the country and different populations. Sorry, Mr. Wells, go ahead.
Not at all. And I'm going to echo what you just said. Maybe all leaders of all countries or all local areas even need to have a international psychology course or two to help them negotiate these cultural differences. Wanted to remind our viewers, we'll be able to go a little bit past 5 o'clock. And so if you still have additional questions that you want to submit, please do use the Q&A tab at the bottom of your screen and send those questions in. We'll go, if Dr. Stevens, if you're amenable to it, we'll go a little bit past 5 o'clock.
Oh, sure.
In those last couple of questions.
Sure.
But I did want to say that as soon as you used that term cultural competency, we got a couple of questions in.
Okay.
But they weren't necessarily related to COVID. So I want to put them out there just because it's, I find them to be interesting, but kind of an amalgamation of the questions that we got here was that if I'm talking to a therapist or a physician, and I'm worried about cultural competency, should I be seeking out healthcare, mental health care treatment from someone who is from my own culture, who's going to understand me better? Or, especially when we're talking about therapy or psychology, can someone from a different culture perhaps offer us a different or perhaps even a better perspective?
That's an excellent question, and I really appreciate the opportunity to try to respond to that. There's been some, let's just look at it this way. When we look at culture, there are many members that identify with a particular culture, and like most populations, they're distributed. Not necessarily in a normal bell curve, but they're certainly distributed. And so the real issue is, if you identify yourself with a particular culture, to what extent are you identified with that culture? If you are thoroughly and completely identified with that culture, I would argue you probably wouldn't be seeking therapy anyway. You might be seeking a local healer within your own community or a religious leader. Or you might certainly, if you're interested in therapy, be seeking someone with whom you can identify with, because of precisely what the questioner pointed out, that you are much more likely to feel understood. And that's the key question. That's the key issue that the prospective client is asking. Will I be understood? And how can this therapist, who is not identified with my culture, not a member of my culture, really do that? So what we found from the literature is that recent immigrants, for example, older folks within a non-dominant cultural group, and individuals who obviously have not acquired sufficient skill with English, they're going to be much more comfortable with someone who is recognizably a member of their cultural group and who actually performs therapy in their native language. But for younger people, it's different. I mean, we're all members of different cultural groups. We're members of our culture of origin. We're Americans. We're global citizens. It gets complicated rather quickly. I think, again, the attitude basically should be that we are partnering partnering with those that we serve. And by partnering, I mean that we adopt this attitude of, number one, critically reflecting upon our own assumptions and biases, that we respect the worldview, the values, the beliefs, the customs of those with whom we work. We are open to learning more, although we don't want to spend our clients' time asking them to educate us, but at the same time learning about what their lived experience is like with respect to the particular health issue that they're presenting. We want to consult as professionals with others who may have expertise that we don't. And it's entirely possible that we could consult with some indigenous healers within the community in which our client is situated. We want to be able to sort of decenter and learn the worldview and perspective of our clients. So that's the way in which we operate from in terms of treatment. You know, one of the things that I've been reading a lot about is there was an article recently on best practices in global mental health. And this was kind of a qualitative study, and so they were interviewing a lot of experts. And one of the things that one of the experts had to say, was a little excerpt from how they responded to the questions, was that, you know, people from different cultures, you know, we're very sensitive. We don't want to impose our values and our interventions on other people. But a lot of folks from different cultures are saying, hey, I'm a human being. Why do you think what works for you won't work for me? And so we, again, may be backtracking a little bit too far and making the assumption that, well, there's something particular that will work for this cultural group or individuals from this group, and we can't possibly find a hybrid or a way of doing that. But it is possible. When I've worked with folks, you know, African American clients, Hispanic clients, gay and lesbian clients, deeply religious clients, I really need to adopt those two fundamental principles that I talked about before that constitute cultural competence, and that is respect and humility. Mm-hmm. And work in a collaborative fashion together to achieve some consensus on what is it that we're dealing with, what's the understanding of the problem, and how can we best approach that problem in a way that you as the client feels is legitimate, is culturally legitimate.
Dr. Stevens, I'm going to pause you for a minute.
Sure.
What you just said is the paradigm that should be utilized in almost any situation or circumstance. Certainly not only within the United States, but globally, when we're dealing with people. Right? You just talked about respect, which leads to validation. That lowers the force field for people. Mm-hmm. That gives them more of the opportunity to open themselves up for communication and for actually hearing while you're speaking, and you engaging them in a way where you two can work together, where the two parties can work together. And that's been one of the major gaps. And you also used a couple of terms earlier, which revolved around something along the lines of joyful anticipatory interaction in gaining cultural awareness and understanding. And that has been the major, major challenge, not just politically, but even socially in a multicultural environment. Mm-hmm. We, you know, places like New York, maybe California, other places may be very different. Certainly in lots of areas where you just commonly are meeting different people and, you know, you're joyfully interacting and so forth. But so many portions of this country are not like that in any way, shape, or form. When it comes to healing, that paradigm is extremely important, but we've not all always practiced that way, whether we're therapists or ologists of some type, or iatrists, or doctors, MDs. We look at, here is what you and I talked about before, that monolithic paradigm that's supposed to fit everybody.
Right.
Okay.
Right.
Even in medicine, we sit down and we say, well, look, you've got this, you take that, you go away. But having worked with a large Hispanic population at one point, if you sit down and say, listen, all you've got is a cold and it's going to go away in 10 or 12 days, you get looked at very strangely because they come from a place where they're always given medication.
Yes.
And so you have to prescribe a drug, otherwise they're not coming back to you for treatment. Okay.
Right.
And it's not that we're saying it by all means, go ahead and do this, practice this way, but it's key to understand who you're working with, who
Right.
you're living with, dealing with.
Right.
And I think that's a very, very important piece that you brought up, those two things. And it's not such that our attitude is, okay, I've got to take the time to learn about this person.
Sure.
It's more of I'm excited to learn more about you so that I can help you, teach me so that I can help you, and we can help each other.
That's right. Exactly.
An excellent piece you brought up. Excellent.
Yeah.
Excellent.
Well, and you raised a great point, because I was talking about partnerships and collaboration and sort of working together. But as you point out, we both had, I'm sure, experiences in which so much deference is given us as the experts that collaboration becomes rather difficult. Well, you're the expert, you're trained, and and the culture really does, certain cultures really imparts deep respect for highly educated professionals. And I wouldn't dare question Dr. Mensah or Dr. Stevens because they're the absolute authorities on medicine and psychotherapy. So collaboration becomes somewhat difficult under those circumstances. So when I talk about partnerships, they're not all the same. They're going to look rather different depending on the circumstances.
That's very true.
Dr. Mensah, I've got an interesting side question that's come in here, asking, you deal with a field of medicine that isn't necessarily mainstream. Do you find that there are certain cultures that are more responsive to nutrient therapy, to orthomolecular medicine, as opposed to going to a traditional, take 2 aspirin and see me in the morning kind of doctor?
That's a great question. There are many cultures that are much more responsive to this brand because they kind of view it as a more natural approach. So I'm going to share you a very humbling story. My dad, the late, great Reverend Albert W.Y. Mensah, when I was about to start med school, I have a first cousin who's practicing in Texas, and he was living with us, and someone had a rash, and we were telling my dad about a rash that this person had, and my dad said, now, you go ahead and just take some of this little thing in this little plastic tube and, give to that person, tell them to put it on their rash, and it'll go away. And I said to him, so Dad, what's in this tube? What is this? He said, what do you care? It works. I said, Dad, look, you have to know what it is, how it works, blah, 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 mechanism, da, 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 da. And, my father, we're from Ghana, West Africa, so I want you folks to understand that. My dad said to me, you and your cousin, you're very interesting people. He said, before there was traditional classic medicine, we were healing bones right there in front of people right away in methods that modern medicine today still can't understand how it was done. A lot of healing practices that were naturally based that can't be explained and quantified by traditional medical mentalities were being illustrated. My father, very bright guy, illustrated basically that because of our new culture, the cultural enrichment of the medical school process and the allopathic way of life has shifted our perspective and our openness to one of being closed-minded about traditional therapies. And so when we now go back to revisit who it is that comes to see us, I laugh because I'm constantly reminded about who it is that I used to be and who my cousin used to be, who's a geriatrician in Texas. And so when we look at this, yes, the populations that are truly more of a holistic natural perspective are very, very interested in this. Certainly the Asian cultures, the Mexican cultures, a variety. But we cannot negate either those individuals who are absolutely trending towards the push away from allopathic medicine. That's not always a good thing either, because there are plenty of things that need to be done very traditionally to fix the patient. But we're seeing now a larger trend in a movement towards what is considered more natural. But I also have to bridge a certain gap here, okay? While we call it mainstream versus alternative therapies or regimens, the piece that's missing is that what people consider alternative is simply not the powerfully understood or embraced aspect of medicine. What we do and what orthomolecular medicine does is the foundation, the literal foundation of all of medicine that is considered allopathic. It is the micromolecular basis upon which even pharmacology is derived. Mm-hmm. We could not know how to treat viruses and bacteria if we didn't go back to basic biochemistry, basic molecular cell biology. And folks, these are even the mechanisms that most of us forget by the time we've been in 10 years in practice. But it is not alternative. It goes back to micromolecular and biochemical. So we're dealing with the underlying foundational pieces of the problem and using those pieces to correct it. So when they say natural, certainly. A gentleman who, his name, I shouldn't say his name, but he got into trouble because he was supposedly curing a lot of these disorders in New York and never had a medical degree. But it turns out what he did was really urbanized biochemistry. His mother had been a great practitioner in their country, and everything was done using the natural elements based upon plants and so forth and so forth. And what do? We go scour jungles as pharmaceutical industries to find the plant that we can then turn into the chemical that we can now turn into the drug. So it's more about where you are on the spectrum. We're really speaking the same language, but the target is different. The correction piece is different, but the foundation is actually the same. So when we talk about natural, yes, we're looking at the natural mechanisms of the problem and trying to correct it. And that's what people are really being attracted to. The individuals, whether they're Native American shaman or they're fetish priests from Ghana, or they're whomever that's doing the medicine, wherever they are, they're looking at how to mix, how to put together the potions, stuff we used to call alchemy back in prior days. We're really all along a different spectrum. And what we're saying in orthomolecular is get back to the grassroots, find the core problem, correct it with those particular natural needs. So Mr. Wells, again, one of my long-winded answers, I apologize, but it's one where everyone, every category, every group has a tendency to have within it a subculture that looks to get back to the natural. Okay, that's really what I wanted to say.
Very good. The other couple of questions that we have left here, I think are reflective of the time that we live in, because we've got some questions that are asking about the social unrest that's going on in the country, and Dr. Stevens, perhaps your take on how some of the protests that have happened here in the United States have seemed to migrate to places around the world, and is that, in your, some of these questions, it's fascinating seeing the way several people are saying the same thing in different ways, but what we're getting is, are people feeling the same things or suffering the same injustices around the world, or are they just feeling an empathy for a certain population here in the United States? Why are we seeing this global uprising?
Hard to respond to that definitively, but it's an excellent question. And I think both are true. I think there is injustice, racial injustice everywhere in the world today. And there has been for all time. And being somewhat cynical, there probably will continue to be. And I think, so I think people are responding to what the terrible and senseless tragedy of George Floyd's death. They're responding to that, but they're also being prompted to consider some of the other utterly unjust violations of basic human rights in their own communities. I think younger people have been better prepared to understand the lived experiences of people who have been oppressed through their own education, even in their own homes. Our culture is changing to begin to acknowledge that reality and not to dismiss it or minimize it. So I think particularly when you look at younger people today, they resonate with the pain of those who have actually suffered. And I think it's a genuine response. And I think it's for the good, because this does need to change. And whatever movement can be made in making the kinds of changes that allow people to live lives in which they're safe, they're treated fairly and justly, they have true opportunity to fashion whatever their lives may take them in whatever direction, it's for the better. So I think there is much more compassion and empathy for what people have seen here in the United States, but I also think it's helping them become more aware of what's happening in their own communities as well.
Dr. Stevens, when I go back to this phrase, and remember when I talked to you about the joyful anticipation of cultural exchange and learning,
Yeah.
It's because it permeates so many different areas, and I mentioned that before. But isn't this, in many respects, why so many people are saying, listen, we've been trying to share with you who we are for, centuries, for a few hundred years for this, and you've taken no interest in really learning about who we are.
Right.
You put this monolithic thing out there that says, hey, this is how it's supposed to be. And what we see is the differences. We don't look to understand you. If we had a situation where folks were joyfully anticipating getting to know one another, I think in many respects, whether it's a governmental association connecting with a certain population,
Mm-hmm.
or whether it's policing, or whether it's even just working together, there'd be very different responses on both ends of the situation, both ends of the spectrum.
Right.
And things would be a lot easier.
They sure.
And we've tried cultural exchange, we tried the so-called education pieces, but are people really listening? Are they really anticipating something positive?
Mm-hmm.
Or are we coming together with barriers up and force fields up about attack and non-validation?
Right.
We constantly devalue each other on many different levels.
Mm-hmm.
And that immediately creates a difficulty in communication and understanding. This is a very important piece you brought up. That's why I keep going back to it, because I think those words you uttered were really, really key.
Thank you so much for saying that. It means a great deal. And I would just sort of add to that one of the biggest challenges is how do we decenter from our own defensiveness so that we can listen?
Yes.
If someone is talking about their personal family experiences with injustice, with oppression, with discrimination, with prejudicial treatment, abuse, how can we listen to that in a way that we don't get riled up, that we're not being personally accused. Because once that happens and you know, our dander is up, it's very, very hard to listen. And so this takes a lot of work. It really takes a lot of work to be able to listen with intent, to be joyous in the discovery, to use your words, of the experiences of other people. There's no easy way to actually get to that point. I'll never forget when the 9/11 attacks occurred, there was a mass rally at our campus. One of the reasons why that mass rally took place was that we were all unified, regardless of our race, sex, national origin, culture, and so forth. We're all unified. But one of the things that you may recall was happening was that there's a lot of anti-Muslim rhetoric and so forth. And there was a history professor here at Illinois State University who himself was Muslim. And he got up to the podium and he was speaking at length. And he ended his talk, if you will, with the simple injunction: if you don't have a Muslim friend, get one. If you want to know what it's like, get a friend. Immerse yourself. Listen. Discover. Decenter from your own worldview and perspective on things, and learn something that will help bring about understanding and peace, and not continue this cycle of misunderstanding and violence and so forth. I think the same thing is true today about whites and blacks and Hispanics. We live in different worlds so often. It's changing, but we live in different worlds. Our experiences are different, and we're challenged, I think, as individuals by this experience, by this tragedy, to really make that commitment, to lower our defenses and listen and discover.
You know, I want to change the switch just for a moment within the context of the whole COVID piece, as many of us have been huddled together with our families, and we've talked about this on previous discussions here. That same paradigm goes for family relationships as well. Mm-hmm. How do we decenter so that we're now open to listening and understanding? And listen, we've had this whole construct present for eternity between husbands and wives, for example. How often do we hear, "You're not listening"? Oh, we're listening, we're not hearing. Okay. Mm-hmm. But do you understand the perspective from whence I'm coming? And successful conversations involve lowering those force fields and decentralizing. And I think that's a very important piece as well as we look to move through this process. Mm-hmm. We've seen statistics where now we've seen that the divorce rate has actually gone up during this time of COVID. Right. Okay. I have an anticipatory belief that we're going to see the baby rate increase within the next 6 to 9 months, baby birth rate, okay, as well. But why is it that these divorces are happening? It's multifactorial, but I think one of the major difficulties of communication is decentralizing, is taking the forgive me, the ego, not the haughty ego, but the I sense of self-center out of the equation, so that we can listen, so that we can hear.
Right. And just being able to talk through some of the changes. I mean, with partners working at home, there's less individual space. It's different. Everything has been reconfigured, and it's stressful, and it's uncertain, and we kind of struggle to kind of get back on terra firma within our own households. And so those, everyone in the family, as you point out, is kind of struggling with this. Kids as well. My granddaughter, really did not like her first grade teacher. Well, a few weeks into, being at home and being bored to death, she wanted to go back to school. So I mean, everyone, our parents, our grandparents, how do grandparents deal with not seeing their grandkids for a while? So there's so many changes, and we really need to be able to, especially now, be able to have these kinds of conversations in which we're decentered, and we can accept the fact that there's frustration and disappointment and fear and so forth, and it's not personal. It just is, and we're all struggling in this together.
Absolutely. Mr. Wells, are there any other questions?
Actually, I was just going to say, I think that's about all we have in the way of questions, but this is actually a pretty good transition, because tomorrow we're going to be talking about a lot of the things that we've kind of wrapped up this conversation with. Tomorrow, we're joining you for a special webinar workshop conversation discussion. We've been able to bring together a panel of three, actually, three proteges of Dr. Stevens, who are now practicing all across the country. Dr. Deanza Spalding in Seattle, Washington, Dr. Karen Brown in Florida, and Dr. Patricia Perez here in Illinois. And the three of them are going to join us to talk a little bit more about kind of how to recapture our collective national mental health during this time of crisis and social unrest. And so I encourage everyone to join us again tomorrow at 4 o'clock Central Time for what should be another important and powerful conversation, much like the powerful conversation that we've had here today. So Dr. Stevens, Dr. Mensah, any parting words before we wrap up?
No, I just, again, want to thank you, Mr. Wells, and Dr. Mensah for the opportunity. There's so much more to say, but I enjoy the informal structure of the hour that we've had together, and it kind of led to some very, very interesting points and counterpoints. So I thank you both very much. And for those of you in the audience who listened and forwarded some questions.
Dr. Stevens, I want to thank you so much for sharing with us the wisdom that you've accumulated personally and sharing your journey and how that shaped your perspective and therefore this very, very important field, which you're considered the leader in this field. And I think it's a true honor for us to spend this time with you. And thank you for accepting our invitation. And thank you for helping to educate me on so many different aspects of this whole process and the problem approach and how to solve this and working towards that. We are looking hopefully very forward to working with you in the future, and hopefully to more of these sessions as we'll be looking to invite you to more discussions and perhaps and other topics related.
That would be my pleasure, and thank you so much. I really appreciate the opportunity.
We also want to thank those of you who joined us today, who listened in, and encourage you, as we do with all of these webinars, later tonight or tomorrow, we're going to post a video replay of this webinar so that it's available for you to go back and revisit some of these outstanding points that were made today. And if you know of others who missed this conversation but need to hear some of the things that were shared today, we encourage you to guide folks to the Mensah Medical YouTube channel where this video will be posted, or look for the Mensah Medical Facebook page. There will be links to this video available on that page as well. And again, don't forget to join us tomorrow for our continuing discussion. Dr. Stevens, Dr. Mensah, thank you for being with us today. Thanks to all of our viewers today, and we'll see you very soon.
Thank you.
Well,